This is my comprehensive head to toe video. This is the room. There's nothing on the walls besides a picture over there. My patient, nothing on the floor, nothing on the walls, a desk. Those are old annuals on the floor of my mother's. This is the table with just all of my instruments and my phone, which I am only going to use for a timer because I don't have a clock with a second hand or a watch, but I will show it before I use it. Okay. Hello, how are you today?
I'm good. How about yourself?
I'm good, thank you. I'm Jordan, I'm the nurse prac student, and I'm going to be doing your head to toe assessment today. Let me just wash my hands really quickly. Okay, and can you tell me your name and how old you are?
Eric Montoya, age 24.
Okay. And can you tell me today's date?
October 23rd, 2016.
Okay. Can you tell me where we are right now?
At the clinic.
Okay, and how would you describe your mood today?
Pretty good.
Good. Okay, so patient appears to be alert and oriented times 3. He is well groomed. He is dressed appropriately for the weather. He communicates well and effectively. And he describes his mood as pretty good. Okay, I'm just going to look at your face, the skin. I'm going to be looking through your hair and palpating your scalp. The patient's face, the head is normocephalic. The head is round. The facial features are symmetrical bilaterally. The facial skin appears to be tan in color. There are no lesions, no masses, no edema noted to the face. The hair is black in color. It is soft. There appears to be no infestations, no lesions, no masses. Is there any tenderness whenever I'm palpating your scalp?
No.
Okay, so no tenderness noted to the scalp. Okay, Eric, can you clench your teeth for me? Good. Can you squeeze your eyes tightly? Okay, and can you wrinkle your forehead? And can you smile? Stick out your tongue? Puff out your cheeks? Good. So cranial nerve 7, facial nerve tested and intact. Okay, and I am going to test cranial nerve number 5, the trigeminal. And what we're going to do is I'm going to touch your forehead or your cheeks or your chin with this cotton ball, which will be soft, or this, which will be dull. And I'm going to have you close your eyes, and then you just tell me when you feel either soft or dull.
Dull. Soft. Soft. Dull. And soft.
Okay, good. So trigeminal cranial nerve number 5 is intact. Okay, Eric, I'm just going to be inspecting your eyebrows and looking at your eyes. The eyebrows are black in color. The eyelashes are distributed evenly, symmetrically, bilaterally. Just going to fill your eyes here. The eyeballs are firm. They are non-tender. I'm looking at the conjunctiva. Can you look up for me? Good. Which appears to be clear with no exudate and no drainage. The sclera is white. The lens is clear. The iris is brown. The eyes are symmetrical bilaterally. And I'm just going to fill right here. The lacrimal apparatus appears to be soft. Was that tender at all?
No.
It is non-tender. Now with the eyes, there are two vision tests that we would perform, the Snellen chart and the Rosenbaum. The Snellen chart is for farsightedness, and we would place a chart 20 feet away. You would cover one eye and you would read the smallest line possible. Then you would do the same with the other eye, and that's the Snellen chart. We're going to perform the Rosenbaum test today. This is the Rosenbaum chart, and what you'll do is you'll hold it about 14 inches away from your face. You're going to cover one eye, and you're going to read the smallest line possible.
428739.
Good. So the left eye is 20/20 vision. And cover the left eye.
428739.
And the right eye is also 20/20 vision. The Rosenbaum chart tests optic nerve, cranial nerve 2, which is intact. Now I'm just going to use my pen light and look at your pupils and into your eyes. Okay, so the pupils are about 3 millimeters and they are equal bilaterally. They are reactive to light. I'm going to check the corneal light reflex while I am here. The corneal light reflex is intact bilaterally. And I did that by shining the light at the bridge of the nose, and the light was shown within the cornea of both eyes. I'm going to check accommodation, which, Eric, if you'll just look at my pen light. Okay, and then look at the wall behind me. Okay, and that was checking for accommodation, which the patient's eyes did constrict as the pen light came closer to the eyes and dilated back to normal when he looked at the wall behind me. Now I'm going to test the extraocular movements of the eyes with the 6 cardinal fields of gaze. If you will again look at my pen light, and I just want you to keep your head straight and do not move your head, just your eyes, and follow my pen light. Good. Okay, so there was no nystagmus noted while testing the 6 cardinal fields of gaze or the extraocular movements. Now another test that I want to perform is called the cover-uncover test, and what you're going to do is you're going to place this sheet of paper over one eye while looking at the bridge or just at my nose, and then when I tell you to pull it down, then I'm just going to be assessing your eyes. Okay, if you'll pull it down for me. Okay, the next eye. Look at me. And down. Okay, so no strabismus noted while doing the cover-uncover test. Now I'm just going to use my ophthalmoscope, which normally I would dim the lights for this, but in this case we're just going to leave them on. While doing this, I use my right eye with your right eye, and also while using my right hand to hold the ophthalmoscope. Okay. And I'm just going to use my left hand on your forehead here to kind of just brace. What I'm doing is I'm looking for the red light reflex, and when I find the red light reflex, I'm going to focus in and find the optic disc, which is yellow orangish in color with distinct margins. The retina is red and there are no hemorrhages noted, no AV nicking. Same thing with this eye. We're going to use my left eye with Eric's left eye and holding it in my left hand. So I'm looking for the red light reflex and I'm focusing in and I'm finding the optic disc, which is yellow orange in color. The retina is red and there are no hemorrhages noted within the eyes bilaterally and no AV nicking. Okay. Now I'm just going to assess your ears. And the ears appear to be symmetrical bilaterally. The pinna of the ear is even with the outer canthus of the eyes bilaterally. The pinna and the earlobes are soft. They are not edematous. They are not red. There appears to be no drainage of the ears. Let me change my instrument here. And I'm going to use my otoscope to look inside your ear by pulling the pinna up and back. The internal ear canal is free of cerumen. There is no redness or inflammation noted. The tympanic membrane is pearly gray. It is not bulging, the bony landmarks are seen, and it is not retracting. And the cone of light in the right ear is seen at 5 o'clock. Yes, cone of light at 5 o'clock in the right ear. The internal canal of the left ear appears to be with no cerumen. There is no redness or inflammation. The tympanic membrane is pearly gray. It is not bulging and no retraction noted, and cone of light is at 7 o'clock. Okay, we're going to perform what's called the whisper test. If you will just cover your left ear, and I just want you to repeat the words that you hear.
Baseball.
Good. And cover your right ear.
Apple.
Good. So the whisper test tests cranial nerve 8, which is the acoustic nerve, cranial nerve, which is intact. Eric was able to appropriately answer the whisper correctly. Now there are 2 tests that I want to perform. One is the Weber test and one is the Rhine test. We'll start with the Weber test. I'm just going to strike this tuning fork on my hand and I'm going to place it on the top of your head, and I just want you to tell me if you hear the sound in both ears the same or more in one ear.
The same on both sides.
Okay. And now we're going to do the Rhine test, which I'm going to strike the tuning fork again on my hand, place it on the mastoid bone, which is behind your ear, and then I want you to tell me when, or you can raise a finger or you can tell me when you don't hear it anymore, and then I'm going to move it to the front of your ear, and then you'll tell me when you don't hear that as well. And with this test, the air conduction should be twice as long as bone conduction. So for this, I'm going to use my timer, which, here's my timer. Okay.
I don't hear it. I don't hear it.
So the bone conduction was about 8 seconds, and the air conduction was at 20. And I'm going to write that down real quickly. And that was to the left ear. Okay. Now we're going to do the same thing on the other ear.
I don't hear it. I don't hear it.
So it was the same on the right ear. Bone conduction was 8 seconds with the air conduction at 20. Now I'm going to inspect your nose, and then after I look at the outside of your nose, we'll look at the inside. So the nose is midline. There appears to be no drainage, no lesions on the outside of the nose. Okay, can you blow out? Okay. Okay. The airway of the nasal passageways seem to be patent bilaterally. And I'm going to grab my otoscope and look into your nose. Okay. Just going to place my hand here. So the nasal passageway is it's pink and moist. The inferior and middle turbinates are seen. They are not swollen. The septum is intact. The right side as well is not swollen, no drainage or exudate noted, and the inferior and middle turbinates are seen. Okay, and now there is another test that we would do. We would dim the lights. It's called the maxillary transillumination test. And what I would have you do is lean your head back and open your mouth. I would shine my light on your maxillary sinuses on both sides. Okay, good. Now the light would appear to be a bright red color or a glowing red color, which would mean that your maxillary sinus is filled with air and not fluid. And I'm just going to inspect your lips and assess your mouth. The lips appear to be pink. They are smooth. There's no lesions on the outside. I'm going to put some gloves on so that I can look in your mouth. Okay. Grab my pen light. All right, can you open your mouth for me? Okay. The mouth is pink and moist. There is no lesions noted on the inside of the cheeks. The gums are also pink and moist with no lesions, no ulcerations. Can you just stick out your tongue for me? The tongue appears to be a pale pink color. It is appropriate in size for the patient's mouth. The teeth are pearly white. There is approximately 32 teeth. Is there any tenderness when I do that? Okay. No tenderness to the teeth. No dental caries noted. Now, can you open your mouth for me? Stick out your tongue and say ah.
Ah.
Okay. And I'm checking your gag reflex. Sorry about that. And that was to test cranial nerves 9 and 10. Sorry, Eric. That is the vagus nerve and the glossopharyngeal nerve, which was intact. Turn my pen light off here. Now I'm just going to palpate your frontal and your maxillary sinuses. Is there any tenderness?
No.
Okay. No tenderness noted to the frontal or maxillary sinus. And I'm just going to assess your neck, which I am looking for any fullness to the neck, which there is no fullness. The thyroid and the trachea are midline. The thyroid is smooth. It is non-tender. There are no masses noted. There is no thyromegaly. And we're going to do a little test to test the thyroid and the cartilages. What I'm going to have you do is take a sip of water, but I just want you to hold it in your mouth. Don't drink it yet. Okay, if you can, I'm going to fill the thyroid on your left side, right? So if you can turn your head to the left and kind of tuck your chin to, yeah, there you go, to your shoulder. Okay, now swallow. Okay, good. So the thyroid and the cartilages on the left side were intact. They rose upward when Eric swallowed. Okay, and if you can take another sip of water, and we're going to do the other side. Okay, if you'll turn your head to the right and down to your shoulder and swallow. Okay, good. So the thyroid and the cartilages on the right side were also intact and raised upward when you swallowed. I'm just going to listen to the thyroid, and I'm listening for any bruise, and I'm listening with the bell of the stethoscope. There's no bruise heard on the thyroid, and I'm going to feel your carotid pulses. The carotid pulse is a +2, and I'm going to also listen to the carotid for any bruise with the bell of the stethoscope. And there is no bruise heard in the carotid bilaterally. Okay. Now, if you will shrug your shoulders against my resistance, good. Okay. Now I'm just going to place my hand on your head in different positions, and if you'll just kind of resist against my hand on whichever side I'm on. Good. Good. Now forward. Good. And good. So that was to test the sternocleidomastoid and the trapezius muscles, which is cranial nerve 11 and it's the spinal accessory nerves. Okay, and for this part, I'm going to have you take off your shirt. Place it over here. Okay. And if you're good right there. Sorry. So right now I'm just inspecting the chest. The chest skin is tan in color. There's no lesions, no edema, no masses. There is some fine black hair to the upper and mid chest. The skin is warm and dry. Okay. The elliptical is with no deviations. An AP transverse diameter of about 1 to 2. The patient's respiratory rate is 16 breaths per minute. It is even and unlabored. And I'm just going to listen to your lungs. And I'm going to listen with the diaphragm of my stethoscope. When I'm listening over the trachea and the larynx, it is bronchial sounds. And this is bronchofascicular sounds. And the vesicular sounds in the periphery of the lung fields. Okay, and if you'll raise your hands for me. You can put your hands down now. And I'm just going to listen to breath sounds posteriorly. Okay, so breath sounds are clear to auscultation in all areas of the lung fields. Okay, and now I'm going to test for any tactile firmitus. So when I place my hands posteriorly on your chest here, I just want you to repeat 99. And every time that I move my hands down, you can just say 99. Okay?
99, 99, 99, 99.
Good.
99,
And again.
99.
Okay? And now I'm going to do it anteriorly, and I'm using the ulnar surface of my hands. So, again.
99, 99, 99, 99, 99,
And one more time.
99.
Good. Okay? And now I am going to percuss the lung fields for resonance. sides here. So resonance was heard in all lung fields. Now, Eric, if you'll just lay back for me and you can kind of scoot back on the table. And I'm just going to be looking at the chest. I'm looking for any heaves, any thrills, any abnormalities. The chest looks symmetrical. No accessory muscle use. I'm going to palpate the precordium. And I'm also palpating the apical pulse, which is the point of maximal impulse. And since the apical pulse is felt, that means that the heart is within its normal within the chest in its position. So palpating the precordium, I don't feel any palpable murmurs, no heaves, no thrills. I'm going to listen to the heart. I'm first going to listen to the heart with the diaphragm, which is for the high-pitched and also low-pitched sounds. But then I'm going to go back and listen with the bell of the stethoscope, which is used for low-pitched sounds, to detect any gallops, any rubs, or any murmurs. And there's 3 positions that we could listen to the heart, and those are the sitting, the supine, and the lateral, left lateral recumbent. And today we're just going to do the supine. So I'm listening in the right sternal border. This is the second intercostal space, and I am listening to the aortic valve, where S2 is greater than S1. The left lateral border, second intercostal space, is the pulmonic, where S2 is greater than S1. The third intercostal space is Erb's point, where S2 is equal to S1. The left sternal border, the fourth intercostal space, is the tricuspid valve, where S1 is greater than S2. And the mitral in the fifth midclavicular line, in the fifth intercostal space, where S1 is greater than S2. And this is also the apical, and that's also the point of maximal impulse. Now I'm going to go back and listen with my bell of the stethoscope for any murmurs or rubs or any gallops. So I'm listening in the second intercostal space of the right lateral border, which is the aortic. Second intercostal space on the left, pulmonic. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid. And the fifth intercostal space is the mitral. And I'm going to grab my timer again, and I'm going to listen to the apical pulse for 1 minute. So, timer. Here is my timer. So patient's apical pulse and heart rate is regular with a heart rate of 62 beats per minute. And while I have you supine and on your back, I'm going to go ahead and do what we call the anterior drawer test to test the ACL ligament. So if you will bend your knee, I'm just going to pull anteriorly here. Good. Okay. Good. So the anterior drawer test was less than 5 millimeters, which is normal. If it was greater than 5, moving anterior or posteriorly, then it would have been abnormal. But in Eric's case, it is normal. Okay. And if you will place your hands to your side, I'm going to assess your abdomen. The abdomen is tan in color. It is flat. There are no pulsations noted, no peristalsis. I'm just going to listen in all 4 quadrants. I'm using the diaphragm of my stethoscope. Okay, so vowel sounds are active in all 4 quadrants. And I'm going to percuss each quadrant of the abdomen, which should sound with sound of tympany. So tympany is heard in all 4 quadrants of the abdomen. And I'm going to go ahead and measure the liver span and also percuss the spleen. And I'm starting at the umbilicus, and I am percussing up until I hear dullness, which will be the border of the liver. And then to percuss down, I'm going to start about the 3rd intercostal space and percuss down until I get the top border of the liver. Okay, and the liver span is about 8 centimeters, which is normal. Normal is 6 to 12. And I'm going to percuss the spleen over on the left lateral side. So there's splenic dullness noted from about the 6th to the 10th intercostal space. Okay. And now I am just going to palpate your abdomen, starting with light palpation. And we're doing each quadrant. there any tenderness?
No.
Okay. Now we're going to do deep palpation. Any tenderness?
No.
Okay, so no tenderness noted on light or deep palpation. And now we're going to perform what is called the Murphy's sign or test, and this is going to test for any inflammation or cholecystitis, which is in the gallbladder. So I'm going to put my hand on the right side here, and whenever I'm going to palpate and push kind of hard, and when I do that, I want you to take a deep breath, okay? Okay, take a deep breath. Okay, any tenderness?
No.
Okay, so the Murphy sign is negative, and there is no tenderness noted to the gallbladder. Okay, I'm going to have you sit up. Okay. And I just want you to tell me if there's any tenderness when I do this.
No.
Okay. And here.
No.
Okay, so no CVA tenderness noted, which would be tenderness to your kidneys. Now I'm going to palpate your blood vessels, so like your temporal arteries, and I'm also going to go ahead and do your lymph nodes at this time as well.
Okay.
We'll start with the lymph nodes. So we're going to start with the occipital, postauricular, preauricular, tonsillar, submandibular, submental. This is the anterior cervical. This is the posterior cervical. Okay, and can you kind of shrug a little bit? Okay, and this is the supraclavicular. Okay, axillary. Okay, axillary. And the epitrochlear. Was there any tenderness?
No.
Okay, so no tenderness noted to any of the lymph nodes. I'm going to feel the blood vessels or the temporal pulse, the brachial, radial, and if you'll put your legs straight for me. Okay, the posterior tibial and the dorsalis pedis. Okay, pulses are a 2+ bilaterally. Also, while I have you like this, I'm just looking and assessing the rest of your skin. The extremities are warm and dry. There's no lesions. I don't see any scabs, no scarring, no tattoos, no piercings. The skin is tan in color. I'm going to look at your hands here and look at your fingernails. The fingernails are firmly adhered to the nail bed. They are pink in color. Bilaterally, I'm going to test the capillary refill. Okay. And I'm doing it also on the toes as well. And capillary refill is less than 2 seconds bilaterally to the fingers and the toes. Skin turgor is, it retracts immediately. Okay. And now I am going to test your deep tendon reflexes. We're going to start with the brachial. Let me go to this side, actually. There you go. Okay. And with this one, I am tapping on my thumb, not on the actual tendon. Okay, same thing. One more time. Okay. And now we're going to do the tricep. Just hold your arm like this. And now the brachioradialis. So you're just going to kind of rest your hand on my arm here with your hand kind of just like that. And I'm striking with the straight end of my instrument here. Okay. And the other side. Okay. And now we're going to do the patellar reflex. Okay. And if you will just still sit, but kind of just scoot back on the table, I'm going to test your Achilles tendon. And we're going to have the knee flex, and I'm just going to hold your foot right here, and I'm just going to do the Achilles right here. Okay, same thing here. Get to this side. Okay. And now we're going to test the plantar tendon, or plantar reflex, I should say. And I'm just going to stroke this on the bottom of your foot. Okay. Okay. So that plantar reflex was like the Dubinsky, and it's negative. Also, back on your nails, I just want to do one more test. If you'll hold your fingers together like this, I just want to look at the angle of your nails. Okay, next finger, okay, and again. Okay, so there is no clubbing of the fingers noted, and the angle of the fingernails are about approximately 160 degrees. Now there's a couple tests that I want to do for coordination. One of them, I want you to put your arms straight out to your side. I'm going to have you close your eyes, and then I want you to touch your nose and then go back out. And we're going to do it with both, okay? And then the other arm. There you go. And keep going. And a little faster. Okay, good. So the patient was able to do the finger-to-nose test rapidly and smoothly. And now we'll do the rhythmic movement, where I want you to put your hands on your knees, and we're going to supinate, pronate, supinate, pronate. And you can start out slow, and then we'll go faster. And you can just do it kind of right here with the legs. There you go. Okay, a little faster. Perfect. Okay. So the patient's rhythmic movements were smooth and rapid. They were both consistent bilaterally. And the next test I want to do is the vibration test, but it's testing your peripheral nerves, or sensory nerves. So I'm going to hit this tuning fork on my hand and just close your eyes, and then I'm going to stick it on a place on your upper extremities or your lower extremities, and I just want you to tell me where you feel it.
Left elbow. Right elbow. Right ankle. Left wrist. Left ankle. Right wrist.
Okay, good. So the patient's peripheral sensory nerves were intact, and he was able to correctly determine where the vibration occurred on the bony prominences. The next test I want to do is superficial touch. And let me grab my stuff here. Okay, so this test, you're gonna have your eyes closed again, and we're gonna test either dull, sharp, or soft. And I just want you to tell me which one you feel and where you feel it on your body.
Okay.
Okay.
Sharp left arm.
Okay.
Dull left thigh. Soft right leg. Sharp left leg. Dull right foot. Soft left foot.
Okay, good. So the patient's superficial touch was intact, and he was able to correctly determine sharp, dull, and soft in the correct placements. Okay. Now, I'm going to go ahead and have you stand up. And what I want you to do is I want you to walk to the wall and then walk back. And I'm looking at the patient's gait, which is steady. He's erect. The shoulders and the hips are in line, and they're symmetrical bilaterally, and they're even on both sides. Okay, and we're going to perform what's called the Romberg test, where you're going to keep your hands to your side, your feet close together, and I'm going to test your proprioception and your balance. Okay, good. So the Romberg test is negative. The patient's balance and coordination was good. Okay, and if you will turn around for me, we're going to check for scoliosis. The patient's spine looks in line with the neck. If you will bend forward and touch your toes for me. Okay, and then slowly come back up. Good. So the scoliosis test is negative, and there is no lateral curvature noted to the spine. Okay, good. Now if you'll turn towards me, let's move this way just a little bit. Okay. Now we're going to check range of motion and passive range of motion. So first we're going to check the shoulders. So if you will hold your hands up and then back down, okay? And then if you'll go laterally up and then back down. Good. Okay, one more time, back up. Now I want you to swing your right arm across your body. Okay, left arm is fine. That is adducting, and now we're going to abduct. Now the other arm, adducting, abducting. Good, okay? And then I'm going to have you turn and put your right hand behind your back, kind of on your hip. Good. And now the left hand. Good. And now if you will place your right hand behind your head. Good. And that's external, and then the left. Good. Okay, now for your passive range of motion, which is normally like 5 degrees more than active range of motion, I'm gonna do this for you. So with the shoulders, okay, we're going up, okay, and back down, and up, okay, and one across, good, and across, good, okay, and back down. Now we're going to bend it behind your back, sorry, behind your back, and then behind your head, and behind your head, okay? And the next one that I want you to do is the knees, and I want you to I want you to flex the knee, extend the knee. Good. Now extend, and the other leg, flex, and extend. Okay, now I'm gonna do this for passive range of motion. So we're gonna flex the knee, extend the knee, okay, flex the knee, and extend the knee, okay? Now I want you to go ahead and sit down. We're going to test the cervical range of motion in your neck. So if you'll tuck your chin to your chest and then extend, okay, and then we're going to go ear to shoulder, and then ear to shoulder, and then turn your chin to the wall, chin to the wall. Good. Okay, and now we're going to test the hands and the wrists. So if you will put your hands like this, good. Okay, and then so flex, extend, make a fist. Okay, now touch your thumb to each finger one at a time. Good, and then thumb to the base of your pinky. Okay. Fingers out, fingers in, good, okay, and now we'll do the wrist, so flex, extend, and then to the ulnar side and radial side, good. So now I'm going to go back and I'm going to do the passive range of motion for your cervical muscles and for your cervical spine, and then for your hands and your wrists. So we did chin to chest, so flexion, extension, side to side, good, okay, and then hands and wrists, so flexion, extension, fingers out, fingers in, fist, okay, hands to the radial side, and then ulnar, okay. Now we're going to do your ankle, so dorsiflex, plantar flex, okay. Now the other one, dorsiflex, plantar flex, rotate it in with the soles to the inside, there you go, externally out, okay, and then rotate external out, there you go, and then in, and then the other foot, in and out, good, okay, and one more, if you will extend the elbow out, flex, and then the other one, extend and flex. Okay, now I'm just going to do that. So extend, flex, extend, extend, flex, extend. And now for the ankle, so dorsiflex, plantar flex, internal, external, and then rotate in, rotate out. Okay? And now we'll do range of motion for your hips. So if you'll lay down and scoot back on the table. Okay? And what I want you to do is keep your knee extended and raise your leg straight up in the air. There you go. Good. Now your left. Good. Okay. And now if you will turn on your stomach. And now I just want you to keep your leg straight with your knee still extended, and then I want you to raise it up in the air without flexing your back, without arching your back. There you go. And now the left. Good. Okay, and back on your back for me. Okay. And if you will put your foot, flex your knee in, and then we're gonna let it go internal, so if you'll let it kind of fall to the middle. Good. And then the other one, up, and let it fall in for internal. Okay, and then back out. I want you to go out laterally to each side, keeping your knee extended. So if your legs are like this, I want you to go out to abduct. There you go, abduction, and then back in, adduction, and then the same with the other leg. Abduction, adduction. And when you adduct, it'll go, you'll keep it straight, but kind of over. You want to try that one more time? Okay, so abduct, adduct, there you go. And then same thing, abduct, adduct, okay? And now for the last one, you're going to bend your knee, and then your ankle, there you go, is going to go there, and you're going to let this fall. Good. So that's external rotation. And do the same thing with your left leg. Good. External rotation. Good. Okay. Now I'm going to do it for passive range of motion. So knee straight, leg up. Now the other side. Knee is extended. Hip is up. And we can do all the front ones before you have to turn. Let's do internal, so in, okay, here, internal rotation, and this one for external, okay, and down, okay, and now we're going out. Over. Good. Okay. Out. And in. Good. Now if you'll go onto your stomach one more time. Okay. Now we're going to go up with the leg. Good. And up with the right. Okay, so range of motion in the shoulders, the ankles, the hips, the cervical, and the elbows, hands and wrists are all full, patient has full range of motion in all of those. Um, if I can have you sit up, and there's one more test that I want to do. If you will stick out your tongue for me. Okay, try to touch your nose. Try to touch your chin, side to side, and in your cheek like this. Okay, and my resistance. So that was to test the cranial nerve, the 12 hypoglossal, which is intact. Okay. Thank you for your time, Eric.
You're welcome.